This is Amber LaValle, and today I will be discussing the application Davis's Drug Guide for Nursing. Published by Atmosphere Apps, Davis's Drug Guide for Nurses provides an educational resource at the nurse's fingertips. The nurse can use this for self-education on medications, for example, the method of action of a medication and nursing considerations for administration. In addition, the app provides patient safety tools for nurses such as calculators, reference charts, and articles regarding medications. The app is available on iOS and Google Play for free for 30 days. Afterward, continued use does require an automatically renewed subscription for $38.99 a year. The purported use of this application, per Atmosphere Apps, is to provide the information nurses need when, where, and how they need it. Davis's Drug Guide for Nurses provides information suitable for education of both the patient and the nurse. On the front page of the app, there are options to examine medications by classification or by name. Below this lists several articles intended for self-education of medications, including pharmacogenics, medication errors, dosing considerations, and patient education tips. Searching a medication by using the classification button pulls up information on common classes of medications, for example, anticholinergics. After choosing a medication, the app lists general method of action information, common interactions, and general assessment tips for the medication class, alongside commonly used nursing diagnoses associated with the classification. Searching for a medication using the Comprehensive Index option provides a pre-populated list of generic and brand name medications that updates as the user types, using tall-man lettering to differentiate between look-alike sound-alike medications. Once a medication is chosen, the app provides a complete listing of all information, including method of action, metabolism, peak effect, side effects, nursing consideration, and patient education. The listing is easy to read and quick to access. Furthermore, the user may bookmark medications for quick access to frequently used medications. The app is easy to use and provides information in an understandable format. The layout is simple, with information available with just a tap. Some features are a bit hidden, meaning they require a few extra taps to utilize the functions. For example, the Tools list requires tapping on the menu button on the home screen, then tapping on Tools, which allows you to choose between the various tools, such as calculators, insulin tables, and educational papers. To access further tools such as printable pictures for patient education on how to use an inhaler would require several more taps. The most common use of this application, the medication guides, are quick and easily accessible. Legally, the application is intended solely as a reference guide to be used by medical professionals. The information uses no personal patient information aside from the use of data inputted in calculators. The information inputted is not saved, nor does it contain any identifying factors of patients. Ethically, the intended user of Davis's Drug Guide for Nurses are licensed medical professionals who are held to the ethical standard of their licensing committee, typically under the ideal to do no harm. It should be noted that this application does contain information of certain mixes of medications that could cause harm. There is a possibility that someone could use this information to harm self or others. Overall, the Davis's Drug Guide for Nurses provides a fairly comprehensive medication resources at the provider's fingertip. The app is quick, easy to use, the information is succinct, well organized, and more comprehensive than a typical Google search. Added features include conversion charts, dosage guides, and IV syringe compatibility charts. Conversely, the application is one of many designed to assist healthcare professionals and does come at a moderate charge. Furthermore, the app is only as good as the totality of the database, so newer medications may be absent. Additionally, the information is not printable to provide as handouts for patient education. Overall, the benefits greatly outweigh the limitations. This reviewer gives Davis's Drug Guide for Nurses 2 thumbs up. In conclusion, Davis's Drug Guide for Nurses provides a comprehensive guide to thousands of medications, as well as important topics such as adverse reactions and multiple drug interactions. Application is clear and concise in its usage with easy-to-use interface. It's available on Android and iOS devices, and while initially free, a subscription is required after 30 days.